So much, Mr. Chair, and thank you to our witnesses for being here today. I love a robust conversation about how we can improve our healthcare system. I don't think any of us on either side would say that the system that we have is perfect and is working exactly as it was intended to. I do, however, have real concerns about saying it's not working, so we should not reinstate these affordable care tax credits so that more people can lose their health care, so that the system is even more broken, and then we have to decide how to fix it. I don't think that's the way to meet the healthcare needs of the American people. It's not the way that they're asking us to meet their healthcare needs, and it's, I think, frankly dangerous for our country. We have, as my colleagues have said, a ticking clock on these ACA tax credits. We were so quick to act when billionaire and big corporation tax credits were set to expire. Congress was called back into session from vacation to make them permanent. I don't understand why we wouldn't act immediately for the benefit of the American people who are struggling with affordability and are struggling with the healthcare system. That said, I think even the original drafters of the Affordable Care Act, including President Obama himself, would argue that the ACA was not the be-all, end-all dream of, healthcare for people in this country. They didn't have the votes for a public option. So yes, giving money to the insurance companies is a large part of what the ACA is able to do, because that's how people are guaranteed health care. Before the ACA, I don't know how everyone's memories are on this. Folks may not have been super engaged. Before the ACA, women who had been pregnant could be denied health care coverage. Folks who had other pre-existing conditions, any healthcare needs, could be denied healthcare coverage. We had very high uninsured rates and high rates of people unable to access healthcare. There are lots of ways to make sure that we solve that problem. The Affordable Care Act was the bill that had the votes to pass at the time. It's been a while. We can revisit rebuilding a healthcare system, like Mr. Frost has said, like single payer, that meets the needs of the people, lowers costs, and ensures a more healthy future for all of us. There are lots of different approaches that countries around the world have taken that have been explored in the United States. I, as a member of the legislature in Washington State, worked on establishing Washington State's Universal Health Care Commission, some of the strongest universal health care policy to be passed by any state in the last 10 years. We know that we need improvements. But we also know that the free market is not the solution for healthcare. An unchecked free market means that, folks who don't have coverage, who don't have the ability to afford care, just won't get it. They'll die often. Yes, you can't shop around in the ambulance, but there are ways that we can provide more transparency into healthcare costs, like Washington and many other states who have created an all-payer claims database that collects and publishes data so that you can look up how much it costs on average to get a mammogram and how much those mammograms cost at different facilities near you. But the problem for most people, especially in rural communities, including many in my own district, many in the districts of my Republican colleagues, are that there are not that many healthcare facilities available and accessible. And those that are at risk of closing because of the dramatic cuts from the big ugly bill to Medicaid. Rural healthcare was at risk before we passed H.R. 1, and now it is hanging by a thread. What does it matter if you could shop around if your nearest two hospitals are 2 and 3 hours away from you? I also think we need to make space for technology, and I know that's what we're here to do today, to talk about how innovation and technology can help lower costs for families. But I hear a lot from my neighbors on Medicare who are worried about unchecked technology and AI impacting their ability to access care. Dr. Obermeyer I'm concerned about the Wiser model and, what that unchecked AI implementation will do to folks' abilities to access care. That's why I'm a co-sponsor of the Smarter Care Act, a measure to ban the Wiser model from Medicare claims. Do you believe that AI systems need independent oversight to ensure patients aren't denied medically necessary care?
Absolutely.
Thank you. I'd like to request unanimous consent to enter into the record a letter from a retired physician in my district, how Wiser will enable companies to profit from pain. Thank you. And I know my time is at the end, so I'll just wrap up by saying, I agree we have to fight consolidation. I agree we have to fight to take some of the costs out of the healthcare system. I agree that more people need access to better healthcare. And what we know is that vertical integration and consolidation of our healthcare systems doesn't lower costs for patients at all. It may lower costs for the provider groups, it may lower costs for the shareholders, but it doesn't lower costs for patients. Thank you.